These are some of the most common musculoskeletal conditions affecting the hip joint. We're gonna start with the hip arthritis. Hip arthritis is the wear and tear of the articular cartilage. Arthritis of the hip can be primary or secondary. Secondary is due to something else, such as a dislocation or a fracture or an operation, etc., etc. Primary, on the other hand, we don't know the causes. So primary osteoarthritis is still idiopathic, which means that we don't know why it happens. And now, what are the signs and symptoms of it? Signs and symptoms, first of all, they are gonna vary according to the level of arthritis, therefore the level of inflammation that there is. Nevertheless, most arthritis happen with pain, stiffness, swelling, decreased range of movement, therefore stiffness, and also with the crepitus, clicking, and tenderness around the area. Treatment usually divides into non-surgical and surgical. Non-surgical, we have exercise and exercise education. Basically, you want to understand what to do and what not to do. Dietary changes, this is to decrease the inflammation, decrease weight on top of the joint, and also to promote the healing process. Physical therapy, medication, hip braces, canes, trolleys, or any help that you can use in order to decrease the weight that goes onto the hip. And then there is also regenerative orthopedics. These are things like platelet-rich plasma injections or stem cell therapy. Then there is hydrotherapy, acupuncture, or even ozone therapy. And then we have the surgical treatments. These are usually three categories. One for hip preservation surgeries, the other one are joint fusions, and then for last there are total or partial joint replacement. Now, when choosing a treatment modality, this depends on many factors. Depends on your overall health, your age, your physical activity, your weight, your job, etc., etc. And most importantly, it depends on the level of arthritis that you have in the joint. Next condition is hip impingement. Hip impingement is the result of extra bones that gets laid down either on the femur or on the pelvis, and therefore it changes names accordingly. We have two types, one is called a cam, the other one is called pincer. It's basically the same thing, just what it changes is the location where the extra bone is deposited. Nevertheless, 85% of the people, they have a combination, so they have deposition of extra bone on both the two areas. Hip impingement gets formed because of a number of factors. One of the most common is definitely repetitive stresses or overuse, especially in hip rotation and flexion during developmental age. These are usually our puberty age, and so if children are doing extra sports, this is what can stimulate the laydown of extra bone in the area that we discussed before. Or it can also be due to a childhood disease such as hip dysplasia, for example, which is very common. Signs and symptoms are stiffness and pain in the hip and or groin area, which are aggravated with activities. There can also be a clicking or a catching sensation, as well as locking or even giving way. Treatment modalities usually depends. At the beginning, you definitely want to rest, reduce the aggravating activities or the aggravating movement, but you also want to do some sort of exercise, which is a combination of strength and stretch, as well as positioning exercises. Physical therapy, medication, hydrotherapy, dietary changes, acupuncture, regenerative orthopedics, and as a last resort, surgery if nothing else has worked and if the hip impingement is affecting your quality of life. Next is a labral tear. Around the hip joint, we have a labrum. This acts as a seal for the joint, and it also makes the joint deeper. A labral tear is basically a tear of this labrum, which is very much similar like a ligament. The causes of a labral tear, they are usually traumatic, so a car accidents, sports accidents, certain repetitive jobs can also be a cause. But also, if you have a hip impingement, this can also tear the labrum, and if there are some structural problems such as, again, hip dysplasia. Signs and symptoms are pain felt around the hip joint that radiates in the groin area. As you have already noticed so far, many of these hip conditions, they all refer pain to the groin area, and the signs and symptoms can be very similar. So all of those conditions, they can overlap each other. This is why a physical assessment is important, or even a scan, in order to determine what is the exact condition so that you can tailor the treatment approach and therefore the recovery. But let's move on. So we said that the labral tear causes pain in the hip radiating to the groin. Now it's important to notice that the pain of a labral tear can also be felt during rest, so you can also feel pain at night, and the symptoms can last a long time, all the way up to 2 years. There can be clicking, locking, catching or giving way. And another differentiation between the previous condition is that there is usually no stiffness, so the range of movement is usually not restricted, but the symptoms are usually felt at the end range of movement. The treatments are going to be exercising in a non-aggravating way, physical therapy, medication, hydrotherapy, dietary changes, acupuncture, regenerative orthopedics, or surgery in most severe cases. Next is a hip dysplasia. This is an abnormal development of the acetabulum with or without hip dislocation. Hip dysplasia is a congenital disorder, so people are born with it, and therefore babies are the ones that they are affected, which means that early diagnosis is key for treatment success. This is why after delivery, the doctor will usually check the hips of the baby to see if there is any pain, any dislocation, or if there is anything that doesn't feel quite right. The causes seems to be purely genetical. However, there are also some risk factors, such as if babies are quite large and there is not enough space in the wound. This can dislocate the hips within the wound itself before the baby is even born. In terms of signs and symptoms, we have usually two types of categories. One is in babies. This is where parents might notice that during diaper change, one hip might be stiffer than the other, or that when the baby starts to walk, there is a bit of a limp. And then the other category is usually in teenager and in young adults. This is where a hip dysplasia was perhaps missed or misdiagnosed during childhood, and now these people have pain in the hip. Now, a misdiagnosed hip dysplasia can cause early osteoarthritis or even a hip labral tear. This can cause hip and groin pain, as well as all of the other signs and symptoms that we discussed previously. Treatments for hip dysplasia, they differ. If the dysplasia was picked up at birth, usually a soft brace will do the job. Or if it is picked up after about 6 months, usually there is a hard brace that can also help the child to develop a proper hip joint. And during the teenage years or early adulthood, usually surgery is the treatment modality, as well as rehabilitation exercise, physical therapy, or acupuncture or hydrotherapy to modulate the symptoms. Now we move on to hip fracture. There are many hip fractures, as you can see from the diagram, and this is definitely a risk factor in the elderly population. This is because it can cause avascular necrosis, and because of this there is a high chance of mortality. Hip fracture is more common in women. This is because of the risks of osteoporosis that comes after menopause. So because of hormonal changes, women, they have a lower bone mineral density later on in life, which can predispose them for hip fracture when there is a trauma. As you can see, there are many types of hip fracture, and there are also different classification of hip fracture, which basically goes from incomplete fracture all the way to a complete fracture with or without dislocation. Signs and symptoms are pain in the groin area and in the hip area, instability, there might be a leg length discrepancy, as well as bruising, swelling, and tenderness around the area. The treatments vary according to where is the fracture and if there is a dislocation or without, but there can be a non-operative management if the person is healthy and can recover on his own, as well as internal fixation or a joint replacement. And now let's move on to bursitis of the hips. There are usually two bursae, the greater trochanteric bursa and the iliopsoas bursae. Nevertheless, the greater trochanteric bursitis is definitely most common between the two. Usually inflammation of these happens because of either trauma directly on the hip or a repetitive activity such as sports or a repetitive job. There can also be a structural cause predisposing to the bursitis to develop. These are things like scoliosis or even a leg length discrepancy. Women are also more common due to either the differences in tendon size or because the pelvis of women is slightly wider than the one of male. Signs and symptoms are tenderness in the lateral side of the hip, pain when lying on it or away from it, pain during weight-bearing activities, pain with prolonged sitting, and there can also be swelling or redness or heat. Treatments again, they divide into non-surgical, which are the most common, and also surgical, which are usually the least common. Non-surgical is manual therapy, therapeutic exercises, low energy extracorporeal shockwave therapy, or even a TENS machine, medication such as non-steroidal anti-inflammatory drugs, painkiller, corticosteroid injection, or even a platelet-rich plasma injection. Ice and cold also works very well, acupuncture, anti-inflammatory foods, as well as sports taping. As a surgical intervention, we have a bursectomy, which is basically the removal of the bursa, and some other surgery that they would repair the underlying tendon damages. And to finish off, I also included the IT band syndrome. Now, IT band syndrome typically refers pain on the lateral side of the knee. Nevertheless, it can also cause hip pain, and therefore I've included in this area here. This is because the IT band originates from two major muscles, which are the tensor fasciae lata and the gluteus maximus. But if you want to know more about IT band syndrome, I would suggest you to go and check my video on causes of lateral knee pain, where you can learn what are the causes, what are the signs and symptoms, and also what are the treatment modalities for it. Thank you very much guys for watching, and as always, please like and subscribe to the channel, and also share this video to people that you think might benefit from this type of information. Thank you again, and have a great day.